Good evening, everyone, and welcome to the Second District Health and Wellness special conference tonight on COVID. Tonight, we will be spending some time talking about going back to school and COVID and the recent events that have been happening. Now, we're going to have an open discussion with a presentation of a few statistics, but I wanted to let you know that the opinions expressed here are those of the brothers and not necessarily represent those of the Omega Psi Phi Fraternity Incorporated. We decided that we would have this conference tonight because we knew that a lot of things have come up with the increase in cases and hospitalizations. So we want to take some opportunity to have an open discussion and hopefully answer some questions that you may have about the current status of COVID. So as we do in our usual fashion, I'm going to pass the baton now to our chairman, Dr. Jedan Phillips. We call him 88, who's going to give us a little bit of overview from the chairman's perspective of our Second District Health and Wellness Committee. Go ahead, Dr. Jedan.
Good evening, Dr. Boykin, aka 78. Good evening, public. Good to see everybody again. Again, as we come together tonight, one of the reasons for this special session was the fact that as we go back and to resume the fall schedule with kids going back to school, we are seeing that the numbers of COVID have gone up along with hospitalization rates. The other big event that's coming up is the emergence of the new booster vaccine that is available. So again, as we've tried to do with our preventive health series with the Second District Health and Wellness Committee, we try to stay out in front of these preventive health information so that in our community, we're able to make informed decisions. And again, what we have seen earlier in this pandemic and when we were more in the thick of things was the fact that a lot of us were operating on individuals were operating on information that was not in fact accurate. So again, we trying to do for ours to help ours as far as making sure we make the right decisions to protect ourselves, because as we've said throughout, preventive health is a lot less costly to us than reactive health care.
Thank you, Dr. Phil. We're going to go ahead and also, as we do in our customary fashion, we're going to have each of the brothers give a brief introduction of themselves and about what they do, and then we're going to get into discussion from that point on. So go ahead, Dr. Wingfield, we'll have you give a little information about yourself.
Hi, good evening, everyone. Once again, it's a pleasure, it's an honor once again to be here. I am Dr. Edward Wingfield. I'm an interventional cardiologist. I practice at Robert Wood Johnson Hamilton Hospital. I'm the chief of the medical staff there at Hamilton. And I think it is time for us to have that conversation once again about COVID as we all enter that realm of getting vaccinated or getting that booster shot. Once again, a lot of questions need to be answered. From a cardiac standpoint, I hope to give us a lot more information on the virus itself, the manifestations of cardiac issues when it comes to the virus, the booster and vaccination data that we see, and just more or less education so that we're more comfortable making that decision to get vaccinated and to inform our family members, loved ones, and so on, to also to pursue getting that booster and being completely informed when it comes to COVID-19.
Thank you, Dr. Winfield. Dr. Isabell, give us your info.
Good evening. Glad to be here. Once again, Dr. Lee Isabell, board certified internal medicine. I do primary care, outpatient care, HIV primary care, as well as inpatient care. I'd like to bring my perspective regarding COVID, how it has risen over the last couple of months. Even the hospital admissions have gone up. I'm happy to be here and share my input. Thank you.
Thank you, Dr. Isabell. Dr. Plummer, why don't you give us your perspective as an OBGYN?
Hi, how you doing? My name is Dr. Christopher Plummer. I specialize in OBGYN and I specialize in high-risk pregnancies. Hopefully today I can convince, especially since the COVID rate has been starting to go up, especially as kids go back to school, about pregnant women getting vaccinated for COVID, because pregnant women are very susceptible to COVID and can have very adverse outcomes when it comes to a COVID infection. And we'll be glad to talk to you guys this evening.
Okay, thank you very much, Dr. Plummer. And last but not least, my man, Dr. Ford, give us your information. Can we lose Dr. Ford? There he is.
How you doing? Good evening. My name is Dr. Kevin Ford, and I'm a board-certified internal medicine physician practicing in Prince George's County, Maryland. And definitely in my practice, we've seen increase in COVID, and hopefully we can get some good information out to the community. Looking forward to the talk today.
Well, thank you so much. So, you folks, you've heard the brothers talk about, cases are going up. Just statistically speaking, for just to refresh everybody's memory, I am a retired pediatrician and practice internal medicine as well. And so I'm going to talk to you a little bit about some statistics. Now, cases are up, if you will. We know that if we talked about a case-by-case positive test rate, we know that the highest rates of positivity tests in the last week happened in New Mexico, Texas, Oklahoma, Arkansas, and Louisiana. Prior to that, Kansas and Arizona were along the group of high testing places. So those were where the high tests were. So, we're going to talk about, hopefully, during this webinar, what we're seeing in our second district in terms of hospitalization. I know each of these brothers have perspective on the hospitalizations and the caseload that they're seeing in their offices here. Also, we talked about hospitalizations being up. They're up approximately 8.7% in the last week or so. That's kind of good news because last week they were closer to like 11, 12%, and they only are 8% this week. But that does not say that COVID is going away. Matter of fact, I think we can see an uptick in cases as time goes on, because what I do know is that these are cases that are reported. Not everybody that has a case of hospitalization is reported. We know that, all the home testing, people that test positive may not report to their primary care, may not report to the center where they test positive, because these home tests, rapid tests, are just that home test. Whereas the PCR tests, the ones done by the labs, are reported to an individual space. So we don't know if that is the definite reflection of all the cases that are going on right now. But it's suffice it to say that the number of cases that we're seeing now are not as high as they were a year ago. They're up, but there's not as high. Probably half of what we saw last year. Death rates are up 10.5%, which is significant because we were way down there in deaths. Deaths from COVID has slowed down significantly, but to see an increase of 10.5% in the last week or so is kind of distressing to me. This is the season where we can get into the respiratory viruses and different things going on. COVID, unfortunately, is going to be our new norm, a new respiratory virus that's going along there. So we're going to be seeing more of that. You talk about the variants. We have a new variant out there. BA 2.86 is the newest one that's out there. It's coming to us from, I think it's Northern Europe, Denmark, and some places over there. But the good news about that one is we do suspect that we have some protection from the upcoming vaccines from that. So not a case to panic yet, folks. The highest circulating variant, we always talked about the BA1s and BA5s and BA4s and things like that. Now we're talking about EJ.5, which is the highest circulating one variant right now, which is 21.5% circulating in the United States. Now, what does that mean? It's just another one of those Omicron variants that has highly mutated. And just like the again, that's followed by the FL 1.5.1, the XBB 1.16.1, and XBB 1.16. And just probably a month or so ago, XBB 1.6 was the highest circulating variant out there. So we got a lot of variants going on about it. So what are we doing as a global perspective in terms of vaccinations? And I'm just going to give you some global statistics that we can talk about that on an individual basis. Right now, of cumulative boosters received in the world, according to the World Health Organization, guess who leads the world in vaccinations? China. China is number one with 826 million plus boosters given, followed by India, followed by Japan, and the U.S. falls in around 4 in that particular aspect. And I think a lot of it's because in the United States, we only give the Pfizer and the Moderna and some Novavax vaccines. Worldwide, the most widely used vaccine worldwide is the AstraZeneca, then followed by Pfizer, and then followed by Moderna. So those are some of the statistics that we're seeing. The peak when we had it last year, females were greater than males, African Americans leading, but now we're seeing that more American Indians, Native Americans, Asians, Hispanics, and then blacks. But blacks have flipped up to the third position where we were once in the first or second position when we were talking about last year this time. So we've made some trends in our communities and taking care of ourselves. But folks, that's not to say that we need, put our guard down. We need to keep our guard up. So that's just some of the things I wanted to bring to you, and hopefully we'll get into more information as time goes on. So let's talk about the cases. Dr. Ford, you're in private practice. What are you seeing in your office in terms of cases and caseloads, and what do you how are you kind of approaching this uptick in things?
Right, and great question. So definitely in my practice over the last, let's say, 3 weeks, we've definitely seen an uptick in the amount of patients who are calling in who are positive for COVID.
Mm-hmm.
I think on average, it's a two physician practice. Each of us probably see about at least three people a day that are calling in for COVID. So it's about 6 people in our practice that are calling in for COVID every day. And I mean, the height of COVID, it was probably almost 50% of all the calls that you were getting were COVID. But like you said, there's still a lot of patients that are having it. And the other thing is, just like you said, not everybody calls in. So people are testing positive. They've been through, this might be their second, third time around with COVID right now. So they kind of think they have a feel of what's going on. The one thing, when you were talking about vaccines, I think it's important to get vaccinated. As we talked about reducing severe illness, death, hospitalization. But the other thing is some of these vaccines reduce long COVID. And
Right.
Long COVID is something else. I have a few patients that have long COVID, which brain fog, shortness of breath, the fatigue. And so I think that's another important reason to get vaccinated.
Right. Yeah, that you bring up a very important point about the long COVID, because we're now seeing that long COVID is no longer going to be maybe a few months and maybe years down the road. But we'll talk about that as later on as we go along. So I know Dr. Wingfield and Dr. Phillips and Dr. Plummer, as well as Dr. Isabell, all are at centers where you see a large volume of patients floating in. Why don't you each one of you talk about how you're seeing at your particular centers? And we'll start with you, Dr. Phillips. What are you seeing in terms of cases and hospitalization rates with you?
Well, we're definitely seeing that there's an increase in the number of cases that are coming into our emergency room. Again, as far as those that are more seriously impacted, we're seeing those that are more vulnerable, more complicated health history, older, of course, unfortunately, unvaccinated, or better yet, not up to date with boosters, because you get quite a few people. They may have gotten one shot in the beginning, maybe 2, but then never got a booster. And unfortunately, after a period of time, 6 to 8 months, that booster effect or that vaccine effect is starting to wear off. I think another thing, and as I would say, being the doctor of the people, I get a lot of calls offline about, people saying they got COVID. And what I'm noticing is I saw a lot of people coming back from Martha's Vineyard in those large group settings. I mean, I know a few folks that there were multiple people in the cruise that they were traveling in that had COVID. I've seen a few people that have come from air travel, specifically from Europe. And again, maybe with what you shared earlier, Dr. Boykin, as far as where we're seeing the new strain come from, that could explain it. But again, sitting in a plane next to someone for an extended amount of time. I know I had an event at my son's school recently for new students, and I went and the gymnasium was packed. I was the only person in there with a mask. I felt a little crazy at first, but again, I felt better that I had, been able to, to protect myself. I think another thing that we're seeing is because of the times, it is another surge as far as the allergy season. So again, these symptoms sort of intersect and resemble one another. So as I have mentioned to people before, if you're a person like myself who suffers from allergic rhinitis or seasonal allergies, probably a good time maybe to start taking your medication. Another thing that I've seen is the impact of long COVID. Just had a good person I know very well that passed from a pulmonary embolus. He'd been walking around for 2 months with like an upper respiratory infection. Again, could have been COVID, didn't get tested, didn't get vaccinated, and ended up dying of a clot. What if that person had a primary care doctor, went in, evaluated the long COVID, got started on a blood thinner, he would still be here now. So, go ahead.
Yeah, that's interesting to talk about the blood thinners. We get three unique brothers on this call, other than all of us on this call. But we know we got Dr. Wingfield from the cardiac perspective, Dr. Plummer talking about OBGYN. And I like to think of Dr. Isabell as our immunocompromised person since he deals with HIV patients all the time. But speaking of the clotting factor, I'd like to hear Dr. Wingfield's take on that clotting issue and what he's seeing in terms of COVID now. So,
yeah, great question there, because that is something that we certainly encounter from a cardiovascular standpoint. I will say COVID is an entity that we had never seen before, and it took us all by storm, all aspects of medicine, from infectious disease to cardiology, pulmonary, because there's so many manifestations of COVID. It impacts essentially every organ system. From a cardiac standpoint, we saw that it thickens the blood and it increased the risk of blood clots, whether it be DVTs or blood clots in the legs, blood clots that travel to the lungs, blood clots in the coronary arteries. So we saw an increase, especially during the whole the major time of the pandemic, patients coming in with heart attacks who had COVID, patients presenting with stroke, with new stroke or blood clots. That was the acute phase, from myocarditis or inflammation of the heart that we see and we pick up on MRI. So from a cardiac standpoint, we've not seen a virus that had that type of impact on the cardiovascular system. The other thing that certainly I will mention, when it comes to even vaccines, there were things that we also discovered in certain populations of people. But overall, it was overwhelmingly safe and reduced severe illness, reduced hospitalizations, and reduced deaths. So at this point in time, what we're seeing, as Dr. Phillips, as well as you, Dr. Boykin, mentioned, certainly there is an uptick in COVID, whether it be in our staff, nursing staff, techs in the hospital, physicians. We're seeing, especially as people come back from vacations, we're seeing more and more people start to go out with COVID. So it's not just like the flu, which you kind of hear people saying, oh, it's just like the flu now. No, we have 2 patients in the ICU with COVID at Robert Wood Johnson. So we certainly are seeing it. And it's not just like the flu. So we need to regard ourselves and get our guards back up and do everything we can to educate and promote health when it comes to COVID.
Good point. Good point. You know, it's interesting that you talk about that from your perspective in terms of what you're seeing there in your hospital, and you talk about from a cardiac standpoint. But let's talk about Dr. Isabell, what you're seeing. You're at a center where you have a unique practice where you're seeing patients both on the primary care and the HIV side of things. What are you seeing? What are the upticks? What are the cases? What is it like in your particular center? And what do folks need to be worried about from your perspective?
Well, what I'm seeing in where I practice in the area, it covers part of New York, part of Connecticut also. It's the organization I work for. So the organization, before we did as providers, we weren't required to wear a mask, but I still wore masks when I examined my patients when I get up close to them. But they sent a letter out mandating that all our staff over the whole organization resume wearing masks due to the uptake because the employers, the providers were getting COVID, and the new the guidelines of being out 5 days until you feel well, or if you don't have a fever within 24 hours without using any Tylenol or anti-inflammatories. So that's with the provider aspect. And patients are testing. Some aren't even testing. So the numbers probably is higher. So they're calling in, or we do telehealth visits. patients are asking for Paxlovid for the treatments if they qualify immune compromise, if they don't have certain compromised kidney function, then there's alternatives sometimes that we have given to these patients. What also some patients have in practice, some are trying to ask for Paxlovid for prophylactic, and it's not to be used for prophylactic. Say, I'm traveling, can you write a script for Paxlovid? I told them, I don't feel comfortable doing that. I don't know if some other providers do that because that can do harm too. It could be self-diagnosed. You don't, and you can take it when you don't really need it, and then you don't want to develop more variants of resistance if you overuse certain medication, Paxlovid. Hospital-wise, I worked at a hospital about 2 weeks. For a while, I didn't really have any COVID patients in the hospital, but I'm starting to see some COVID patients in the hospital. Majority of them are on the floor, but it's maybe 1 or 2 in ICU. Some have been vaccinated but have not gotten the booster, but there's still a lot of patients that are out there that aren't vaccinated. Unfortunately, some that decided not to be vaccinated, those may be more sicker, and unfortunately, we still having some death. The numbers are low, but it's still out there. The concern is when the weather gets better, colder, winter, the number is going to go up as the virus mutates. So these are some of the things that I'm seeing where
I think it's an interesting fact that you talk about the cold weather because I think a part of that is, and we'll probably talk about this a little bit as we go along the road. Part of the prevention, part of mitigation for COVID is adequate ventilation, and you know that in the colder months we're all closed in together and probably have an uptake in cases from that perspective as well. But before we get to that point, ladies, we always have somebody here for you to bring it home for you. So, Dr. Plummer, bring it home for our women. Tell us about what's going on for women's health in terms of COVID, what you're seeing now.
Well, what I see with fetal medicine is that I think the vaccination has come through. I haven't seen a lot of hospitalization or ICU admissions as I used to compared to a year or even 2 years ago, which is really good. There is probably an uptick in COVID infections just due to the home testing. But a lot of them are just symptomatic, and we usually will treat them symptomatically unless they start to feel shortness of breath or things like that, or they have an O2 sat down less than 95 or 92. Mm-hmm. And obviously then they'll need to be coming in for admission. Then we also have nasal cannula, vapotherm. We have a lot of modalities that started to improve their treatment in there, but I haven't seen the heavy hospitalization and when you walk through the ICU. I remember a few years ago, even a year or two ago, all the doors were closed, COVID. Now, it's only you occasionally would see that. And also with push with vaccination, I've seen a lot less, but still yet protection is always and prevention is always important. Wear a mask when you're out in public, because when you're pregnant, you're very susceptible to diseases because your immune system is a lot lower. Get vaccinated. Vaccination, you can be vaccinated during the pregnancy, and when you're also vaccinated, those antibodies also go to the fetus, also goes to the baby, and also gives protection, passive immunity to the baby.
It's interesting. You talk about vaccinations. I want to shift just a little bit here and talk about vaccinations. We know there's probably on the order of about 1.5 million or so vaccines that have been distributed. But in the United States alone, we're probably only given about 1.33 million. So we got it's a big gap between what's been distributed out there and what, folks have actually seen. So I think that people still have some concerns about the vaccines. And I know that, Dr. Wingfield brought up about the heart. There's a certain population that were susceptible to the myocarditis that we were seeing. But the benefits of the vaccine far outweigh the risk of getting myocarditis. And that was a certain age group, probably young males between, teenage years and into their 20s, they were getting that. And so the answer to that question was just to spread out the vaccines a little bit long. So they're giving it every 4 weeks, maybe give them every 8 weeks. And I think that kind of quashed that a little bit. There's still studies ongoing about the myocarditis, but I think we're finding the same things that we found as we were going along to be true. But let's talk about the vaccines. Let's talk about who gets the vaccines, because I think it's a very important point. I think right now, from my perspective as a pediatrician, who gets the vaccines? We know that the vaccines, the original COVID vaccines or the OG vaccines were approved for down to 2 months of age. But now we're talking about these new vaccines that have been approved by the FDA, and then the CDC just got to sign off on to be given. And we're talking about now, the American Academy of Pediatrics talk about the age of vaccinations for all people. It should be anyone 6 months and older should get the vaccine. And probably in your perspective, Dr. Ford, Dr. Phillips, and maybe Dr. Isabell too, you see older people. So those people over 65, another big high risk group for getting those things. So anyone want to just jump in and talk about your thoughts on the upcoming vaccinations? Because I think there's going to be some confusion about it, because we talked about the monovalent vaccines, they were the original COVID vaccines, which had the original COVID virus and the Delta virus. I think people have forgotten about Delta virus. So it protected against that. Then we came out with the bivalent one, and that was the one to protect against the Omicron and the original one. Now, the new vaccines come out going to be the monovalent. Again, folks, don't get confused by the new monovalent vaccine. The monovalent vaccine is going to be the ones that specifically directed at Omicron and its children or its variants and things like that. So the new recommendation now, you need to have everybody need to have at least 6 months old to have the new monovalent vaccines. But let's talk about, what do you guys think? How are you preparing for the upcoming vaccine in your office? Anybody else want to take that around with it? Go ahead.
I'm going to get my shot tomorrow, actually. So I'll send all of y'all a picture when I get it done. But, again, I think one point as we enter this new vaccine, only 20% of eligible adults in the United States got the last booster. So we're actually working at a deficit. Again, as I mentioned a few moments ago, 2 friends that were not supposed to pass, both passed from suspected COVID, So again, we're seeing that it's still playing a role. I mean, for me, as far as my patients, I actually have worn a mask, not because I'm mandated to, because at our hospital, it's up to the patients if they want us to wear a mask, but I'm using the mask as a tool to bring up the conversation point of the vaccine. So, because they're like, oh, are you sick? Or why are you wearing the mask again? So I'm using that as a conversation point, and I'm really gearing my conversations towards individuals that may be immunocompromised or have some type of medical condition that can compromise your immune system age-wise. And if you're a person in high exposure, I am being a little more strategic and tactful with my younger patients, because you still are seeing a lot of parents that are still very apprehensive. For me, I'm going to get the shot for my son because he plays sports, and I want him to be able to compete and not have to worry. And for me, I feel that it has made a difference, because we had a COVID scare in my house today. He had a friend who he plays basketball with. That friend, the household has COVID now, and he has seasonal allergies, and they were acting up this morning. So we had to do 2 COVID tests today. Thankfully, they were negative. Mine was negative. My wife's was negative. But again, it speaks to the realness of what we're still dealing with. And as I mentioned earlier, if you got allergies, get on top of them, because they can lead to some confusion. But I'm trying to get them the vaccine or have the conversation with those that are most vulnerable first. And again, the other that are in spaces such as the kids in school, I'm definitely recommending it to them as well.
So you talk about that, getting the vaccine and things like that. We know that getting the vaccine is not going to prevent you from getting COVID. I want to make that point clear right up front. It's not going to prevent you from getting COVID, but the benefits of getting the vaccine far outweigh the risk of getting disease and long-term COVID from getting the disease. So the question, any one of y'all want to take this question? I'm just going to throw it out there and play devil's advocate. do I need to get vaccine now? COVID's been out there, and I've been around folks that had COVID.
To Dr. Phillips, when I seen patients in the office regarding getting COVID vaccine, I had some patients ask, "Is it available yet? Should I get it?" And I said, "With your medical problems, age, I do recommend it." Some patients are still concerned about the unknown. This is new. Hearing less of myths, but there's some patients still have some concern. I also am telling them about the flu shot, the flu vaccine. Some patients, the older ones I see, are even asking about RSV. Do I really need this vaccine? I said, if you are immune compromised, if you have COPD, congestive heart failure, certain age, you are at risk. If you have grandkids, you go around, you can pick it up, or even COVID, and you can get sick. So these three things I have recommended to my patients.
I think
before you started, say something, Dr. Ford.
Yeah, I think that's a standard conversation in my practice. I mean, everybody that comes in, and I think everybody really needs to get it. And some people we know who's never got the vaccine, obviously not boosted. That's a harder conversation. And if some people are just stuck in it, that they're not going to get it, I'm not going to break them. But other people definitely, a lot of them listen. A lot of them know it's important to try to prevent. And when you start talking about long COVID, right, people start to listen, because almost everybody knows somebody who's still suffering from COVID symptoms when they had it over a year and a half ago. Right. And I think that's so important to try to prevent that. And Dr. Isabell mentioned about flu vaccine. They talk about the triple threat, getting the flu, COVID, RSV, and definitely patients that are immunocompromised or have chronic lung disease. Another thing that patients that have a higher risk of hospitalization and death are people who are obese.
Right.
Okay. And so we can't, we got to really look at our obese patients to make sure that they know that they're the definite higher risk than just the average person.
Yeah. Yeah. And I think I should bring up, because I heard the murmurings out there, misinformation is still running flagrant out there. Talk about so-and-so got the vaccine and they had a major cardiac event, or so-and-so had this and they died. But I think there's a big myth, as with every vaccine out there, folks, there's gonna be some folks that can have some untoward effects. Let's talk about the flu vaccine, for example. I think the ones that get the most play are those ones that are hyped up in the media. Let's talk about the flu vaccine. There's a chance that anyone getting the flu vaccine can have something called Guillain-Barré. Well, flu vaccine got beat to death a few years back because one of the Washington, at the time they were called the Washington Redskins cheerleaders, got it. The 1 in 1 million chance of getting Guillain-Barré, she got it. And they played it up so much, in media so much that people were not getting the flu vaccine. The same things happened with these few isolated cases of folks that had some untoward effects after they got the vaccine. Whether it's related to COVID or not, it's just that, folks. It's just a few people that may have that. So I don't want folks to be afraid. I know vaccinations are choice, but I don't want people to take those two cases that they're probably out there and say that well, look at so and so, they got the vaccine and they had a cardiac event, and so and so got this and they died, and so forth. So those are just myths that it was directly related to. It's not been correlated at all, as far as I know. And if I'm wrong, brothers, please correct me. But Dr. Biff, from your perspective, you've seen people get the vaccine, probably had some cardiac events, but by and large, the number of people you've seen in your practice that got the vaccine, how many of those probably had a lot of cardiac untoward effects?
Cardiac effects from the vaccine?
Yeah.
I think that created more of an excuse for people not to get vaccinated, as you stated. Some of the issues are within certain subsets of the patient population. For example, it was the second dose of the mRNA vaccine in young adolescent males where we saw the myocarditis, right? So we saw inflammation of the heart after the second dose, which was short-lived, and there was no long-term manifestations. But if you did an MRI on these kids, and they were under 30, you would see inflammation similar to a typical myocarditis. We also saw patients who had, I think, the vector-based vaccination, older women, who had blood clots after getting it may have been the J&J vaccine. So that created, fear of getting the vaccine. But when we looked at the numbers for the myocarditis, it was 41 per 1 million, right? And it was only within those males under 30, maybe had something to do with testosterone levels at that time. And so it was just created a reason for people not to get vaccinated when it didn't even affect their population. So I think there are far more reasons to vaccinate yourself, be boosted, because of what we see in terms of the effects of COVID. So it's always a risk benefit that we weigh, and the benefit far outweighs the risk of that vaccine. So
I don't. Go ahead, Dr. Phillips.
No, I just want to underline what you said and what Dr. Winfield's saying is the fact that this new vaccine, and Dr. Ford said it as well, has the ability to impact you in a positive way with preventing this long COVID. And I think it is something that is really, truly emerging, and we really are not, as in the general population, don't even realize how many people that have had it are still like, I don't feel right.
Yeah. I mean, Dr. Plummer, I was going to ask you, I've read some data somewhere along the line that women that had the vaccine, their children have a better chance of not getting disease that's going on. Can you speak a little bit about the women and the newborn aspect of the vaccines, or whatever you want to say about the vaccine?
Well, when they say you're not able to vaccinate until 6 months of age, getting vaccinated when you're pregnant will give you antibodies, and also breastfeeding. Your infant will give antibodies and their protection until about 6 months, when usually most women will theoretically supposed to be breastfeeding until. So that gives some added protection, and also the passive immunity of the antibodies coming from the woman's body going through the umbilical cord, going through the placenta, umbilical cord, and going to the baby also provides some antibody coverage, so to give the baby some protection after it's delivered. So, and generally, I just talk about the vaccine. I mean, sometimes they worry about this, or am I going to die? I'm going to have this. And I said, you're taking more risk. You're driving out to come out to see me than you would from getting from the vaccine. But, COVID is real. And when they do get sick, and they can get women can get very, very sick. They can develop blood clots. They can develop respiratory issues. Sometimes we will have to. I remember the days doing a C-section in the ICU because the ventilation was so poor on this woman when she was hospitalized. So, the benefit sure outweighs any theoretical risk. So therefore, we recommend that women, get vaccinated even when they're pregnant, or even when they're not pregnant, just to get vaccinated just for protection.
Yes, we talk about vaccination. That's just one part. Our focus on these webinars and these conversations that we have is prevention. So vaccination is certainly one of the best ways to prevent getting COVID. What are some of the other things you're telling your patients, to help maybe boost their immune system or protect them during this upcoming respiratory season? What are you guys telling your patients? I mean, I always tell my patients about vitamin C, for example. What are you guys telling your patients?
Get vaccinated. Get your flu shot. If you have any other respiratory ailments or any chronic conditions, get them in order, because again, a diabetic that is not in order will be a vulnerable person. An asthmatic that doesn't have their asthma in order will be a vulnerable person. A person that has out of control allergies is going to be a person that's looked at and not wanted to be around, because they're going to be like, yo, get that sneeze in order, as Dr. Plummer just sneezes.
Yeah. So Dr. Ford also brought up about obesity. We keep forgetting that part, guys. Folks, I don't want obesity to be in a negative way. I mean, people that are overweight for where they should be. There's a certain amount of what we call the BMI, the body mass index, that we equate to being obese. And obesity carries within itself, without COVID, a certain amount of morbidities, in terms of diabetes, hypertension, and probably even some clotting disorders, if you will, as well. So, you know, folks, we need to talk about it. So now we're getting back to the season where we're going back to work. We've been off for a summer. You know, we've been on Martha's Vineyard. You know, we've been to Europe for the summer. We've been to Spain. Our kids have been off on their vacation. Now they're going back to college. Our younger kids are going back to school. What do we need to be telling our people now to prep themselves other than the vaccination? Because, you know, we know vaccination is a choice. What do we need to be telling our people now, you know, in preparation for this upcoming winter season of respiratory illnesses?
Wash your hands. I mean, that is one of the biggest keys, because most of these viruses are transmitted when you touch something, rub your eyes, rub your nose, and keep your and the mask. When we had the mask mandate, you really didn't really touch your nose or your mouth as much because you had a mask on. So now since the mask mandates are now over, it goes right back to hand washing, which for centuries reduced the amount of diseases or transmission of diseases.
You know, I find it interesting. You talk about hand washing, because before COVID got out, it wasn't an issue for folks to wash their hands to prevent getting the flu. But now when COVID got so politicized, washing the hands like, you violate my rights to do blah, 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 blah. No, folks, it's just part of good health. Taking care of yourself, wash your hands. Very good point. What are some of the other things that we should be telling our folks from your perspective, guys?
Besides wearing a mask again?
Yeah.
Because that can definitely help prevent. We always say, "Oh, mask mandate's over." Yeah, nobody has to mandate me to wear a mask. I can see that somebody comes in my office, people are going to come in because they're sick, they're coughing, they're sneezing, think they have allergies when they really have COVID. All of those things. Another thing, when we're talking about testing,
okay,
you may not test positive initially.
Right.
So you may think that, okay, I'm okay. I just tested. It was normal. You need to test again in another 48 hours. And then again in 48 hours, you're having symptoms. And it's a good chance you'll be able to pick it up that way, because it's not just that one test, right? Especially when the symptoms just started. So you definitely have to repeat your test at least in 48 hours and maybe again in another.
Because at first, we know from previous COVID information, the first 2 days you may not show any antibodies, anything in your bloodstream. And folks, make sure you check the expiration dates on your COVID test too, if you got any. I just threw away a bunch of tests that I had here. They were like expired in May of this year. Some of them expired last year. So check your test for expiration date. You want to go ahead and say something, Dr. Plummer?
Oh, no, I was just talking about during the masking time, I think there was a decrease that we noticed in the flu, in colds, in gastroenteritis and all that. So obviously, masks, do work. The only problem is it becomes very political. People do like to see people's faces and smiles. But again, when it comes back to the uptick, just in New York State, when we had the flu, the flu season, we just had to wear our masks in the hospital. And that probably the same thing we'll have to wear in public.
Make a good point. Go ahead, Dr. Isabell.
Yeah, to add to when we say wash your hands, we're talking about 20 seconds, not just 5 seconds running of water. That's not washing your hands. It's 20 seconds, both sides, lather them, and then rinse them off. That's the correct way to wash your hands. I don't. People may not know the correct way of how long you're supposed to wash your hands. Not just running water over, you're not getting rid of the virus. Also, compliance. We talk about patients, they have pre-existing conditions, and if you're not compliant, it talks about eating healthy. That can help. Exercising helps strengthen your immunity, and eating healthy foods. All these things and taking your medication every day, not as selectively, because that would help boost your immunity if you have diabetes, breathing issues, HIV, or immune compromise. If your viral load is hot, have a viral load, your CD4 count low, that puts you at a higher risk of complications. So these are some of the things. And just because if you're sick and you know you're sick, think of others. Don't go visit your grandma if you know your illness, or you go to work because you're feeling like you're in denial because you thinking this is allergy, or because you don't eat. But if in the past, if you're sick, just stay home. Yes, the COVID may be negative, but we talk about that triple threat. RSV is going to rise. The symptoms could be the same. Cough, sore throat, headaches, sneeze. So that's why I was saying, if you're sick, stay home. That's what I would tell some of my patients. And then flu season is coming too.
Yeah. So Dr. Wingfield, what do you want to tell folks before they had to come see you as a cardiologist? What folks be doing? I mean, we pretty much said everything here, but anything you want to add to what we already said?
Yeah, I mean, one thing that Dr. Isabell alluded to was strengthening and boosting your immune system. We know that vitamin D is very important in your immune system and your immune health. And in fact, when it comes to COVID, patients who had low vitamin D levels were more likely to be admitted to the ICU, be on ventilators and things of that nature. So part of the therapy is definitely vitamin D. So no, and typically if you have your vitamin D level checked, your vitamin D is going to be low unless you're on some sort of supplementation. So taking vitamin D is definitely one way to boost your immunity, boost your immune system. Getting your pre-existing medical condition all tuned up, your blood sugars, your diabetes, your blood pressure optimized, all of those measures, eat healthy, and again, exercise.
Okay, so let's pivot a little bit here and talk about treatment. Dr. Isabell brought up earlier about the different things. We know now that we can treat people as young as 2 months of age with different antivirals if they would be someone that would contract COVID. We know there's the old one, I always call it Vector because I keep forgetting the name of it, remdesivir, and we've got Paxlovid and Lagevrio. So let's talk a little bit about when should folks consider that and how should they consider that, because some are oral and one is IV only. So anybody want to take a shot at those treatments?
Well, again, usually with me with the oral treatments, Paxlovid has been the one I've used most frequently. I tell all the people, as soon as you get COVID, if you feel you've got it, contact us right away. Because again, one of the most important things with these medications are the sooner they get started from, closer to the onset of your symptoms, the more effective they can be. The longer you wait, the less effective they can be. I make individuals that are high risk, even before they get COVID, to understand that if you were to get it, reach out. Because again, I think you would be a person that should take Paxlovid. Go ahead.
And I think you make a good point, because with his bros, I'm all right, I ain't got nothing going on. I just got a little cold. I'm just gonna hang out with the bros, and we end up being a index of infection in COVID. We don't seek treatment, because we the bros. So I want to say to the brothers out there, if you're sick and you think you got COVID, don't be shy about it. You're much more of a man to go and get checked for COVID, start treatment, and be out there hanging out just to be hanging out with bros. So get your treatment done if you think you got COVID, because these medications have to be started, as Dr. Phillips alluded to, have to be started within a certain amount of time. All the oral ones that I know have to be started within 5 days, and the IV one has to be started within 7 days. And the IV one can only be given by a accredited healthcare provider or accredited infusion center. The other ones can be given oral by your doctors in your office and things like that. So I want to just make that point out there, because like Dr. Phillips said, Paxlovid is probably the most heard about one out there, but there are others. Lagevrio as one, and then the Vector, which is the remdesivir. So we talked about uptick in cases. We talked about a little bit about transmission and how you get it. And we talked about vaccine, and we talked about what we need to do about going back to school. So we get kind of to the top of the hour, but a couple more things we want to talk about before we do that. What are some resources for folks that they want to find out about what they need to do for COVID? I mean, do you guys have any particular things that you use, sites you use, handouts you give in your office for in terms of preparation for the COVID season? I always recommend folks go to the CDC's website, they talk about isolation and use that a calculator to calculate if they need to be in isolation, when, where, and how, based on their exposure and things like that. But what are other things y'all giving or recommending sites for? Particularly, I mean, I know there you can go and figure out where you can get a vaccine from if you want to do that. Are you giving any other education materials out there?
I think the state Department of Health site in New York, I'm sure other states as well, is another good place for you to obtain information as far as specific locations. Now, we talk about this new booster. I think another unique thing that we haven't discussed thus far is that it's going to be completely commercialized.
Yes.
So it is going to be something that you're going to have to use your insurance for, which is problematic for individuals that are underinsured or uninsured, which makes up probably almost about 30 million people in the United States. So for those individuals, we actually in Long Island, in the New York area, we're actually letting them know sites and locations where they can go get a free vaccination. We are even in my at my hospital, we're going to be doing some vaccination pods with the medical students, giving uninsured, homeless individuals the shot as well.
Yeah, I think you make a good point there, because I think the government had said something in the last couple of weeks or so about, with these vaccines coming available, that everybody will be available to get them. If you don't have the money or the funds, there'll be some resource for you to get them, but everything is going to be commercialized through your provider, and insurance can cover most of those things. Pretty much mandated to do it, if I understand correctly. So anything else out there? Anything else about, prevention and with COVID and information if they get COVID? Because I know the things that folks got to think about is what to do when they test positive, what to do, when to retest, and things of those nature. I mean, that's beyond the scope of what we're going to talk about tonight and what we talked about tonight here. But what's the first day of isolation? When do I start isolation? When do I end it? And as Dr. Isabell alluded to earlier, if you're having symptoms and you've been isolated, but you're feeling better, but you haven't completely improved, you can think about ending isolation without using Tylenol or Advil or anything that lowers your fever, and if you haven't had a fever in 24 hours. So it's one of the things you think about. But there's all that information out there, folks. I mean, there's a wealth of information about what you do. There's no more like, I don't know what to do. They don't know what to talk about. We have, over these last 3 years, we have streamlined and kind of fine-tuned what to do. It's a simple thing to do. And I don't think much has changed since we come through. We got it, as I said, we got it kind of down pat. And we know if you get symptoms, test. If you test positive, what to do. If you test negative, retest in 48 hours. If you test negative after that 48-hour period, you're good to go, as long as you don't have any symptoms. Okay? So, do that. Boost your immune system, folk. And just remember, not everything is COVID and not everything is a flu, because we got all three of them, flu, COVID, and RSV. So I'm going to ask you this time if we will take this few minutes of brothers give their little closing remarks, and I will start with you, Dr. Ford. We'll work our way back up.
All right. And I just wanted to piggyback on the isolation real quick. And after that 5 days, on the 6th day, even if you feel better, we say you can break your isolation, but you still have to wear a mask for the next 5 days. And so to complete that whole 10-day process. So I think that's something that we need to make sure that people understand. But I'm glad that we were able to give out some information today on COVID, and hopefully everyone will get vaccinated. Thank you.
Okay, Dr. Plummer, will you give us your closing remarks for our women folk out there and for everybody in general?
All right. Well, glad to be speaking to you guys again tonight. Basically, the whole thing is prevention. Get vaccinated. It's not an issue when you're pregnant. Also can get vaccinated for flu and RSV. Those when you're pregnant, that protection can also be transferred to the unborn baby, and also when the baby's born, give it some protection in this first few months of life. And that's it. And also, don't be afraid to wear a mask, because it can help, prevent you from getting COVID or the flu. Thank you.
Thank you. Dr. Isabell, give us your remarks.
Thank you. COVID is on the uptake. So I recommend speak to your doctor regarding vaccines for COVID, for the flu, and RSV. Yes, vaccines may not prevent 100% from you getting the illness, but it gives you your body some protection. It gives you some reinforcement to fight off these infections. Also, if you're not feeling well, you feel sick, and if you do test positive for COVID, yes, there's medicine out there. There's Paxlovid, but speak to your doctor, learn, because there could be some side effects of Paxlovid. The biggest one is metallic taste in your mouth, or other GI symptoms, or if you have to make sure it doesn't interact with your medication that you qualify. But there's a substitute, molnupiravir, which sometimes if you can't take Paxlovid because your kidneys. And then the third one is remdesivir, which it used to be 5 days, but now it's 3 days. And get the vaccine, keep well, eat healthy. Thank you.
Thank you, Dr. Isabell. Dr. Wingfield.
Thank you. Once again, an excellent production here. I tend to end with the same message, regardless of what we talk about, and that's be in control and take control of your own health. Be proactive about your health. And one of the ways we can be proactive is obviously being vaccinated, right? Be in control of what we can control. We know how this virus has affected African Americans and people of color. Disproportionately, we are affected. So please take all measures possible, and one of those is being to get vaccinated. We also did talk about the issues in terms of the long-term manifestations of COVID. So to avoid those things that we're still seeing, I mean, from a cardiology perspective, my office volume is up significantly since COVID because of patients with long COVID and arrhythmias and tachycardias and heart issues related to COVID. So again, be in control of your health, take control, be proactive, get vaccinated, get boosted. Thanks again.
Thank you, Dr. Wingfield. The 88, Mr. Chairman, Dr. Phillips, give us your takeout.
Well, again, number one, I want to thank you, 78, for the impromptu, transition hop into being a moderator tonight. Thank you, my brother. Appreciate you, and all you do for all we do, because we wouldn't be as effective without you. So appreciate you very much. Again, as we've been saying, folks, prevention costs you all a whole lot less than reaction. Get your physicals, do the things that can make you safe. If you do get COVID, again, confirm with your doctor what the steps are to make sure that you're safe. If you have vulnerability, if you're older, if you have medical conditions that can compromise your immune system, if you're on a train every day going to work, all of these are situations that could put you at a higher risk. And as we know, even if you don't get COVID that's serious, we know long COVID is serious. I have a person who is a chef, had COVID and now have challenges with their taste and smell. I have a person who went to Harvard Business School, got the job of their life, have this brain fog and is no longer able to perform their job. So again, even though we're talking a lot about COVID itself, that long COVID is another problem that is significant, and we don't even know how much more significant it will be, and time will tell. So my message to you is take this opportunity to protect yourself. We gave you a lot of means of protection. One of those means is definitely, in my opinion, you should get vaccinated. I'm going to go get my shot. I will have it this week, and we'll let everybody know. So again, I'm willing to be the guinea pig. But as I said, prevention costs you a whole lot less than reaction, y'all. So protect yourselves. In addition, please continue to pay attention to our monthly webinar series. We'll be back in 2 weeks for our monthly routine health preventive talk and the last Wednesday of each month moving forward. So please continue to join us. Thank you.
Well, there you have it, folks. We thank every one of you for coming out tonight and listening to our information that we gave you about our COVID. As we've all said, COVID is no longer a come and go disease. It's going to be with us for some time as part of the new norm. So please consider getting your vaccination. I know vaccination is a choice, but it's a better choice than not getting vaccinated and suffering the consequences of it. Also, this season, it's time to start getting your flu vaccines. For those of you that are over 65, you want to get the high dose flu vaccine. And for those of you that are over 60 and may have some underlying illnesses, you should consider getting the RSV vaccine. So once again, folks, thank you for coming out. We hope we've given you some information and some tools to deal with this in the upcoming weeks and days and get through this winter season without any lots of untoward effects. Thank you very much and have a good night.